South Korea's response to the coronavirus outbreak has been described as one of the best in the world. But before the country's response was kicked into high gear, leaders in Seoul downplayed the crisis. Days later, a cluster of infections exploded in the southern city of Daegu. The epicenter of the outbreak was a secretive church led by a man his followers believe is immortal. From there, the virus spread. On February 23rd, President Moon Jae-in acknowledged the earlier assessment was incorrect.
대규모로 일어나고 있는 신천지 집단 감염 사태 이전과 이후는 전혀 다른 상황입니다.
South Korea would have the largest number of infections in Asia outside of China.
We popped the champagne too early.
Dr. Yoo Bung-wook is a familiar face to South Koreans, appearing on TV as an expert voice on the coronavirus pandemic, and giving even more advice on YouTube. It isn't the first time the country has faced an epidemic. In 2015, Korea faced the largest MERS outbreak outside of the Middle East.
MERS coronavirus changed a lot of life of Korea because it was really scary. Fortunately, we prepared the test kits and the test method and the manual we done December 2019.
The country was ready for the COVID-19 outbreak. From drive-through kiosks to hospitals to local clinics, hundreds of test sites were available across the country, and the tests are largely free.
Why not we do like a drive-through the way? It's minimum contact from the doctors and the patient.
For the elderly or those too ill to step out, medics visit their homes to take swabs for testing.
Anyone who wants to test it, they can visit the community hospital or general hospital. The hospital is named by Korean government. We do service for anyone who wants.
There's even an app that tracks the location of where COVID-19 patients have been, so users can avoid those places. The measures helped South Korea manage the rate of infection and flatten its curve. On March 23rd, South Korea announced that cases were at the lowest since the outbreak. But Dr. Yoo warns that his country is not out of the woods yet.
Watching about it until June in Korea. This is my personal opinion.
On the same day South Korea made its announcement, cases in the U.S. were on the rise. New York State is one of the hardest hit, seeing a rapid rise in infections. Dr. Yoo explains how numbers get so high so fast.
One infected person could be a 3 make the 9 make the 27, 27 make the 81, 81 make the 243. So if you are one of the sources, can be infecting more than 200 for the next day. So please keep the social distancing.
On March 24th, President Trump said he wants the U.S. to be open for business by Easter, alarming many American health experts and lawmakers. They say that's not enough time to get the virus under control.
It is alarming to hear the president say that without medical and health guidance, that he would put the economy or starting the economy ahead of saving lives.
Most people think that we're weeks away from the peak, if not months, and that's what the advice we're getting from the smart folks at Johns Hopkins and NIH and University of Maryland and places like that.
While it would be nice to say that this will be behind us in 2 weeks, that's really not what the data tells us.
In the last week of March, the U.S. is still dealing with an escalating crisis. April 12th seems like it's just around the corner.
Thank you very much. Thank you.